Done.
Good morning, everyone. Am I audible? Hello, am I audible? Okay, we shall start. Today's topic is macrolides and other miscellaneous antibiotics. Now, today's topic is a little big one, but still I have simplified it. The reason being there are many antimicrobial agents we need to discuss today. I have simplified it as much as possible. So to begin with, we'll first discuss about macrolides. Now, macrolides, these are the antibiotics which have macrocyclic lactone ring to which the sugars are attached. The first member of this group is erythromycin, which was discovered in the year 1950. Later, roxithromycin, clathromycin, and azithromycin were discovered. Now, this is the classification of macrolides. Under macrolides, we have erythromycin, clathromycin, azithromycin, roxithromycin, and spiromycin. Then we have ketolides, which are modified macrolides. In that, we have telithromycin. A little bit about the source of the erythromycin. Erythromycin is obtained from an organism, Streptomyces erythris. Now, it is widely used as an alternative to penicillin, whereas the newer agents like roxithromycin, clathromycin, azithromycin, spiromycin, these are semisynthetic derivatives of erythromycin. Coming to the mechanism of action. Macrolides act by inhibiting bacterial protein synthesis. To be specific, they inhibit protein synthesis by binding to the P site of 50S ribosomal subunit of the bacteria and thereby inhibit translocation step. Now, to explain the mechanism of action of macrolides, we have this picture. So as you can see here, the ribosome where the protein synthesis takes place, it has 50S ribosomal subunit and 30S ribosomal subunit. The upper part is 50S ribosomal subunit, the lower part is 30S ribosomal subunit. And in the 50S ribosomal subunit, you have A site and P site. A site is the acceptor site. So to this, during protein synthesis, what happens is the tRNA along with the growing peptide is attached. The next step is translocation, where this tRNA with the growing peptide is translocated onto the P site. This step is called as translocation. After this, the acceptor site becomes free so that it is ready to receive new growing peptide. Now, when we give macrolides, what they do is they block this P site. As a result, what happens is the growing peptide along with the tRNA cannot be translocated from A site to P site. As a result, what happens now, the A site is not free to receive the new growing peptide. Now, this is how protein synthesis is inhibited by macrolides. You have many other antimicrobial agents which also act by inhibiting protein synthesis, but their binding sites will be different. We have streptomycin, chloramphenicol, you have tetracycline. All these act by inhibiting the protein synthesis. Coming to the spectrum of activity, macrolides spectrum of activity is quite similar to penicillin. They are mainly effective against gram-positive organisms and few gram-negative organisms. Under gram-positive cocci, it is effective against Streptococcus pneumoniae, Streptococcus pyogenes, and few staphylococci. Under gram-positive bacilli, it is effective against Bacillus anthracis, Listeria monocytogenes, and Clostridium tetani. Under gram-negative cocci, it is effective against gonococci and Moraxella catralis. Under gram-negative bacilli, it is effective against Legionella pneumophila, Bordetella pertussis, Bordetella hensale, Haemophilus influenza, Haemophilus ducrei, H. pylori, and Campylobacter jejuni. Under acid-fast bacilli, it is effective against Mycobacterium cancer and Mycobacterium avium complex and also Mycobacterium leprae. Under spirochetes, it is effective against Treponema pallidum. Miscellaneous organisms include Mycoplasma pneumoniae, Ureaplasma urealyticum, Chlamydia trachomatis, and Chlamydia pneumoniae. Now, basically, erythromycin and the macrolide group of antimicrobial agents are bacteriostatic. That is, they inhibit the multiplication of microorganisms. They do not kill the microorganisms. Now, coming to the mechanisms by which organisms develop resistance to macrolides. The first mechanism is these bacteria, they may bring about some alteration in their cell membrane so that there is decreased entry of macrolides into the bacteria. The second mechanism is they may develop some active efflux mechanism by which they can throw out the macrolides. The third mechanism is Enterobacteriaceae organisms, they produce esterase enzyme which will hydrolyze the macrolides. Now, cross-resistance is very common among the different group of drugs between macrolides, chloramphenicol, and clindamycin. The reason being the binding site of macrolides, chloramphenicol, and clindamycin is very close by. And you may also see cross-resistance among azithromycin or erythromycin or Clathromycin. Pharmacokinetics. Coming to the absorption, erythromycin absorption is variable. The erythromycin base is acid labile and therefore we give it in the form of entry-coated ester tablets which are acid stable. Food decreases the absorption of erythromycin. Whereas Clathromycin is quite acid stable, it is well absorbed and it is absorbed even in presence of the food. Azithromycin, it is acid stable, but food decreases the absorption of azithromycin, so it has to be given empty stomach. Coming to the distribution, macrolides have extensive distribution. Clathromycin and azithromycin, they have extensive penetration into the cells, but they do not cross the blood-brain barrier or CSF penetration is poor. Azithromycin has large volume of distribution among the macrolides and it has the longest half-life of around 40 hours. Elimination. Among all the macrolides, only Clathromycin is partly excreted by kidney, whereas the rest of the macrolides are mainly excreted by liver. Erythromycin and azithromycin, they are mainly excreted in the bile. None of the macrolides can be removed by hemodialysis if at all there is toxicity. Now here, as you can see, only Clathromycin is excreted in urine, whereas the rest of the macrolides are excreted mainly in the bile. Adverse effects. The most important and common adverse effects of erythromycin is diarrhea. The reason being it stimulates the motilin receptor in the GI tract, which increases the GI motility. So therefore, diarrhea is very common complaint of macrolides. Erythromycin can cause hypersensitivity reaction where you can have fever, rashes, eosinophilia, and skin eruptions. Cholestatic jaundice can also be seen with erythromycin. High doses can cause reversible ototoxicity. Drug interaction. So you all know erythromycin is an enzyme inhibitor. So it inhibits cytochrome P450 and thereby it will inhibit the metabolism of theophylline, carbamazepine, valproate and warfarin resulting in their toxicity. With terfenadine, estimazole which are antihistaminics and with cisapride which is a prokinetic drug. It is known to cause QT prolongation or what we call it as torcidus depointis. And with statins, there is increased risk of myopathy. Now, in this picture, as you can see, macrolides, that is erythromycin, inhibit the metabolism of atorvastatin, carbamazepine, cyclosporin, simvastatin, theophylline, valproate, and warfarin. Coming to the uses of erythromycin, it is used in the treatment of upper respiratory tract infections, soft tissue infections caused by gram-positive organisms, urethritis caused by MRSA, that is methicillin-resistant Staph aureus, and also Ureaplasma urealyticum, Mycoplasma pneumoniae, and also enteritis caused by Campylobacter jejuni. It can be used in chlamydia infections like urethritis or epididymis cervicitis and pelvic inflammatory disease. It can be used in pneumonia caused by chlamydia pneumoniae. It can also be used in gonorrhea caused by gonococci. It can also be used in the treatment of ophthalmia neonatorum. Erythromycin orally, it can be used in the treatment of acne. It can be used in the treatment of pelvic inflammatory disease caused by susceptible organisms. Coming to therapeutic uses of roxithromycin. The spectrum of activity of roxithromycin is quite similar to erythromycin, but it is more potent against Moraxella catarrhalis and Legionella and less effective against Bordetella pertussis. Coming to uses of spiramycin, spectrum of activity of spiramycin is similar to erythromycin, but it is weaker and it has limited use. It is the drug of choice in the treatment of toxoplasmosis during pregnancy, and it can be used in the treatment of cryptosporidium, which is the commonest infection in HIV individuals, where you will have watery diarrhea. Uses of clarithromycin. It can be used in the treatment of respiratory tract infections like pharyngitis, tonsillitis. It can be used in skin infections. It can be used in Mycobacterium avium complex infection. It can be used in the triple regimen for the treatment of H. pylori associated with peptic ulcer. Clarithromycin has a lot of adverse drug reactions like hepatotoxicity, pseudomembranous colitis, which is caused by Clostridium difficile, where you have diarrhea, Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug rashes with eosinophilia are commonest side effects of clarithromycin. Coming to therapeutic uses of azithromycin, compared to erythromycin, the spectrum of activity of azithromycin is wider. It is effective against Chlamydia trachomatis, Mycoplasma pneumoniae, gonococci, and toxoplasmosis. It can be used in enteritis caused by Campylobacter jejuni. It is effective against H. influenza, so it can be used in bacteremia, meningitis, epiglottitis caused by H. influenza. It can be used in respiratory infections caused by Moraxella catarrhalis. It can also be used in the treatment of sinusitis, chancroid, which is a sexually transmitted disease. It can be used in non-gonococcal urethritis and cervicitis. It can be used in the prevention and treatment of Mycobacterium avium complex infection in HIV individuals. Adverse effects include pseudomembranous colitis and GI upset. Ketolites. As I have told you, ketolites are modified macrolides where in the erythromycin structure, 3-keto group is added in place of deoxy sugar. Under ketolites, we have telithromycin. The mechanism of action of telithromycin is similar to erythromycin, but the major difference is it binds to the ribosome more tightly so that the chances of development of resistance is less. Like erythromycin, it also has enzyme inhibitory action, so it can cause theophylline, terfenadine, and cisapride toxicity. It is used in the macrolide resistant community acquired pneumonia and streptococcal pharyngitis. Next, coming to the lincolsamide antibiotic, under that we have clindamycin. Mechanism of action of clindamycin is similar to erythromycin. That is, it will bind to the P site of the 50S ribosomal subunit and it will inhibit the translocation step during the bacterial protein synthesis. Spectrum of activity includes it inhibits Corynebacterium diphtheriae, Corynebacterium acne, nocardia, actinomyces, toxoplasmosis, and more important, it will inhibit anaerobic organism that is Bacteroid fragilis. Pharmacokinetics, it is well absorbed orally. Its plasma protein binding is 90%. It's short acting, metabolized in the liver and excreted in urine and bile. Adverse effects include hypersensitivity reaction and pseudomembranous colitis, which is the major drawback of clindamycin, and it can be even fatal. Uses. It is mainly used in the treatment of anaerobic infections and also mixed infections, which are common in lung abscess, abdominal infection, and pelvic infection. It can be used in the prophylaxis of endocarditis before dental surgery in patients who are allergic to penicillin. Topically, it can be used for acne vulgaris. It can be used in the treatment of pneumocystis carinii pneumonia in HIV individuals. Clindamycin along with pyrimethamine can be used to treat toxoplasmic encephalitis in HIV individuals. The next drug is linezolid. It belongs to oxazolidinone group. Now this linezolid is a synthetic antimicrobial agent. It is effective against the resistant gram-positive cocci and gram-positive bacilli. The spectrum of activity includes it is effective against methicillin-resistant Staph aureus, vancomycin-resistant Staph aureus, vancomycin-resistant Enterococcus. It is also effective against streptococcal pyogenes, streptococcal viridans, streptococcal pneumoniae, Mycobacterium tuberculosis, listeria, and the anaerobic organism that is Bacteroid fragilis. Mechanism of action is similar to erythromycin. So it also inhibits the translocation step during the bacterial protein synthesis. Development of resistance to linezolid is less, but still some organisms have developed resistance to linezolid by developing an active efflux mechanism. Pharmacokinetics, it is absorbed orally, it is partly metabolized in the liver and it is excreted in urine. Its T-half is around 5 hours. Now, linezolid is a reserved drug which we use it for only serious infections. It is not used routinely. It is used in serious community acquired pneumonia, serious hospital acquired pneumonia, bacteremias, serious wound infections caused by drug resistant gram positive bacteria. It is also used in MRSA and also endocarditis caused by Enterococcus. Adverse effects, it can cause mild GI upset, But what you have to look out for is the neutropenia and thrombocytopenia. So regular blood count needs to be monitored. Next, we have streptogramins, otherwise called as pristinamycin. It's a combination of streptogramin B and streptogramin A. Streptogramin B is otherwise called as quinopristine. Streptogramin A is called as dalfopristine. They are combined in the ratio 30:70, and it is a synergistic combination. Mechanism of action, they act by inhibiting bacterial protein synthesis. Spectrum of activity, again, it is a reserved drug used for only resistant organisms. It is effective against MRSA, that is methicillin resistant Staph aureus, VRSA, that is vancomycin resistant Staph aureus, VRE, that is vancomycin resistant Enterococcus. It is also effective against Legionella, Neisseria, and Chlamydia. Uses It is used for resistant infections caused by MRSA and VRE. Adverse effects, it is not administered orally, it is administered parenterally, so you can have pain at the site of infusion. And the other important side effect is it can cause arthralgia myalgia syndrome, where you will have muscle pain and joint pain. Next, we have polypeptide antibiotics. Now, this group of antibiotics, they are powerful bactericidal agents. They are not absorbed orally, but you cannot give them systemically because they are highly toxic. So usually we are using it only for topical purpose and for local actions. This includes polymyxin B, bacitracin, colistin, and thyrotricin. The major toxicity of this group of drug include nephrotoxicity, neuromuscular blockade, and neurological toxicity. Polymyxin B. It is mainly effective against gram-negative bacteria except Proteae, Serraceae, and Neisseria. Mechanism of action, it is bactericidal in nature. It has detergent-like action, that is, it will disrupt the bacterial cell membrane. As a result, there is leakage of all the intracellular contents, resulting in death of bacteria. Pharmacokinetics, it is not absorbed orally. Parenterally, we do not give because of its toxicity. Coming to adverse effects on topical application, it can cause skin rashes, which is rare. Uses, it can be used in skin infections, burn infections, otitis externa, or conjunctivitis caused by gram-negative bacteria. It is usually used in combination with neomycin in the form of powder or eardrops. Next is colistin. Its mechanism of action and spectrum of activity is quite similar to polymyxin B, but it is more potent on Pseudomonas, Salmonella, and Shigella. It is used orally for its local action in bacillary diarrhea caused by E. coli, Salmonella, Shigella, and also Pseudomonas enteritis. Next is bacitracin. It is also bactericidal in nature. When we look at the spectrum of activity, in contrast to polymyxin B and colistin, bacitracin is effective against gram-positive organisms like Staph aureus, Streptococcus, and Clostridium difficile. Mechanism of action is different. It acts by inhibiting the bacterial cell wall synthesis. It is not absorbed orally, parenterally not given because it is highly nephrotoxic. Uses, it is used topically for infected wounds, infected ulcers, or for the eye infections. Next is the Fucidic acid. It has narrow spectrum of activity. It is a topically used antibiotic. Mechanism of action, it acts by inhibiting the bacterial protein synthesis. It is mainly effective against Staph aureus. So it can be used in skin infections like boils, folliculitis caused by staph organism. It is available as 2% ointment. Next, we have the glycopeptide group of antibiotics. This includes vancomycin, one of the reserved drug which is effective for resistant organisms. Vancomycin is obtained from Streptococcus orientalis. Mechanism of action, it acts by inhibiting the bacterial cell wall synthesis. Spectrum of activity, it is effective against MRSA, that is methicillin-resistant Staph aureus. It is effective against Streptococcus viridis, Enterococci, and Pneumococcus. It is also effective against Clostridium species like Clostridium difficile, Corynebacterium diphtheriae, and Bacillus. Uses, as I have told you, it is a reserved drug used for only resistant infections. The reason being it is highly toxic. It is used orally in the treatment of pseudomembranous colitis caused by Clostridium difficile. So vancomycin is the drug of choice for pseudomembranous colitis. Here it is given orally. The other indications are it can be used in infections caused by MRSA, enterococcal endocarditis. It can be used in the empirical therapy in meningitis along with ceftriaxone. It can be used in serious skin infections, soft tissue infections caused by gram-positive bacteria. Now, adverse effects. As I have told you, vancomycin is one of the most toxic drugs. When administered IV, it can cause pain at the site of injection. It can cause nephrotoxicity and ototoxicity, which are dose dependent. And the ototoxicity is irreversible. It can lead to permanent hearing loss. Then it causes something called as red man syndrome. So this is because of the release of histamine. You will see flushing, pruritus, and erythematous rashes on the face and upper torso. So this can be prevented by giving slow IV infusion, or you can give antihistaminics prior starting vancomycin. Next, we have the other glycopeptide antibiotic, that is Ticoplanin. Now, its mechanism of action is similar to vancomycin. It also inhibits the bacterial cell wall. Its spectrum of activity is also similar to vancomycin, but it is more active against enterococci. It can be given IM. Its T half is around 3 to 4 days, so it is quite longer acting compared to vancomycin. Toxicity is less compared to vancomycin. It can cause rarely hearing loss, and the reactions, that is the erythematous rashes, are less compared to vancomycin. Uses, it can be used in enterococcal endocarditis along with gentamicin, or it can be used in infections caused by MRSA or penicillin-resistant streptococci. It can also be used in pseudomembranous colitis as an alternative to vancomycin. So this completes today's topic. So please note down the important questions from this topic. Macrolides can be a long essay, so you can have classification of macrolides, describe the mechanism of action, uses, and adverse effects of erythromycin. So this is one of the commonly asked long essay. Then as a short notes, you can have vancomycin, streptogramins, ticoplanin, polypeptide antibiotics, clindamycin, and linezolid. So these drugs can be asked as short notes.